and let's welcome Momfident.
Do you know that 44% of moms in Bulgaria changed their mind to have another kid due to finding motherhood hard? In fact, being a mom is the greatest gift, but it can also be a challenge. And that's shared globally by women worldwide. In fact, 1 out of 3 women are experiencing anxiety, worry, or depressive symptoms. 1 out of 7 are experiencing postpartum depression, and only half are being treated. The topic is still highly stigmatized. The healthcare system is not addressing it, and specialists share that moms would seek support when the problem is already critical. On the other hand, there is plenty of research on the topic that's written in complex academic language. That's how we teamed up with renowned research institutions to combine existing research and AI and provide evidence-based support in an easy and accessible way. We created Momfident. It's a 24/7 AI psychological assistant in mom's pocket to mimic a conversation with a specialist and give support on topics like parenting, child bond, relationships, self-care, mental health, and more. How it works? We firstly profile based on cultural, psychological factors, and then we lead an individualized conversation, asking the right questions, and then giving you an evidence-based support with advice, coping strategy, etc. And if the topic is more critical or based on the screening results, we would refer you to a specialist. What's our secret sauce is that we have a proprietary data set, a verified research that's simplified by AI. We've created a conversational methodology together with psychologists, and we have the technology. What our goal is to make women's health accessible to all, starting from the postpartum period, but then including other critical psychological stages such as fertility, pregnancy, menopause, and more. I'm Zhenya. I'm a second-time founder. I'm also a mom. It all started with my personal experience. In Iowa, I was CTO, experience with Fortune 500 companies. We have previous work together for 10 years. And Professor Stoyanka Chavkezova, who is our Chief Research Officer from the Bulgarian Academy of Sciences. We are also backed up by an operational team, mentors, investor, advisors. What's our revenue streams? 2 major focuses, of course, B2C direct subscriptions, but the major focus is on the B2B licensing and selling of packages of subscriptions. This can be hospitals, corporations, private health insurance companies, etc. The maternal mental health market is expected to grow by 29% CAGR, reaching 179 billion. And we envision 44 million obtainable market coming from 150 million clients. I actually have a news we just launched yesterday. After hundreds of iterations with mothers, with specialists, we have more than 100 downloads for less than 12 hours. We have a team of 15 specialists. We already have 2 B2B clients, a hospital and a corporation. And we did the first national psychological campaign in Bulgaria, which was backed by national media organizations and leading companies. What we are looking for is on our scaling journey, 500,000 euros for the period of 19 months to get us to almost 3 million annual recurring revenue by end of year 3. Help us in making the psychological care accessible to all, because this can be you, your wife, or your employee. Thank you.
Thank you for the presentation. Now let's move to the Q&A. Please.
Hi, thanks for the presentation. Could you elaborate a little bit more on how it's additive to the, let's say, the average large language model, ChatGPT, etc. So if I want to ask the same questions on ChatGPT versus your platform. Thank you.
Yes. So on one level, we have, as I said, a proprietary data set that's simplified by AI. This is into our RAG system. And then with this data set, we fine-tune our custom model. And for that purpose, we have gained support from EuroCC Austria, who is giving us a lot of supercomputing power, and also Sofia Tech Park. We also have Google Cloud as a partner. So in short, we fine-tune our model with a data set that previously has been simplified but verified by specialists, because we build a community of a lot of specialists we work with.
Hi, thank you for the presentation. Could you tell us whom you consider your competitors at this moment, and maybe a bit your plan of expansion, just to elaborate on it?
Yes, this is a competitors right over there. On one hand, there are solutions, applications, or even traditional things that focus on the topic, but mostly on care for the baby. And then on the side of AI psychological assistance, they're more focusing on general aspect, like every aspect of a person's life, whereas we take the specific and go deep dive into the topic of maternal health with the goal of prevention for postpartum depression. So that's what makes us unique, the fact that we have, for these 2 years, built a solid data set and also the technology.
Sorry, very quickly, in what languages is it available? What languages?
Yes, so obviously all the research is in English, but through AI we translate it into local language. Now that we are live in our local market, Bulgaria, obviously the conversations are in Bulgarian, but the most authentic and best version is obviously in English. This is not stopping us to adopt in other local languages. For example, we have Hamburg University of Applied Sciences and also Belgium University as partners, so we can target these regions of the world as well.
Thank you very much. The time is up. This was Morph. Thank you for the great presentation.